What's up, everyone? Morning. So I am heading to the dentistry show. I'm at the Excel Center right now. Just got upstairs, so catching my breath. But yeah, guys, looking forward for this event. Stay tuned. So yeah, guys, I am going inside. Let's go. Gonna go to Dentistry Show London, as you can see from there. Yeah, you seen it clearly. Morning. You seen it clearly with the sign where it was. It's in N2. So time check, it's almost 10 in the morning. Still early. And I have a surprise for you guys for today's event. As part of the Society for British Dental Nurses, I'll be doing a talk. So the topic is secret for now. You'll see later. But yeah, I'm looking forward for this exciting day. So yeah, we're heading to N2. I can see it right now. Let's go. I need to print my badge though. So yeah, let me show you the main entrance of the actual event.
A few minutes later.
I'm inside the Excel Center now. I'm gonna start exploring today's event, but first I need to find out where the K35 stand for my SBDN team. And yeah, don't know what's happening right now, but it's too early. It's not busy at the moment, but yeah, we're getting there. Somehow it's still in a relaxation mode for every stalls that are here at the dentistry show. But yeah, guys, it's looking good. Many familiar brands that I've seen from last year, so it looks incredibly well organized. But yeah, man, I need to find out where's K35. Where am I? I think I'm almost near. But yeah, it's a talk here at the moment. So yeah, guys, I'll catch you in a bit. Let's go.
Otherwise the noise around and about is quite poor. I would like to take this moment to just say a huge thank you to Renz, who's a new ambassador for the Society of British Dental Nurses. We never actually hear very much from our dental nurses, our male dental nurses, but our male dental nurses in secondary care. Secondary care is quite often not on our radar. So I'm going to let Renz do the wonderful introduction of his work to date and listen to his presentation. I'm going to hand over to Renz. Thank you very much.
Hello everyone. Everyone can hear me loud and clear. Good morning. So again, my name is Renz. I'm the lead dental nurse working at Hamilton Healthcare in Campus. So I'm going to discuss about dental nursing in oral maxillary theatres. Yeah, let's go. infection control, the importance of communication, and the definition of teamwork. Learning objectives: to be able to identify the role of a dental nurse in theatre setting, obviously in the hospital, to demonstrate aseptic technique to describe infection control, to develop clear and concise communication, and to perform effective teamwork. Learning content: by the end of this session, you'll have a greater understanding of the role of a theatre dental nurse, the aseptic technique, and how infection prevention and control techniques are applied in the setting as well, as the importance of communication. Finally, you'll have a greater understanding of the importance of teamwork, and these are the GDC development outcomes. The synopsis: the session will focus on dental nursing working in hospital theatres under oral maxfac specialty. And this is me during the assistance of a GA case with a surgeon. So the role of a theatre dental nurse. First of all, I just want to ask who's here who works currently in the hospital. Right, so only a few. And the rest are in practice? Community as well. Amazing. So the role of a theatre dental nurse, obviously we support and assist oral maxfac surgeons, the team, in providing high standard skilled care for our patient. Obviously, theatre is a specialty area. We focus more on their care from the moment that they been presented and then to the moment they come into the theatres. So overall, we support them in hands-on and obviously in administrative duties, making sure we have the correct medical history form, consent form, and everything. And obviously, as you all know, dental nurses, we are the first assistants of our surgeon. So we prepare and maintain surgical sterile environments. So as you all know, theatre is a strictly controlled theatre sterile environment because obviously we look after patients with operations. Obviously we have to adhere infection controls. And then ensuring surgical instruments and equipment are ready and available. In terms of preparing a surgery for a patient, we have to prepare it for at least a week, making sure that we have the right instruments, we have the right kit, we have the right consumable items, equipment that we need. For example, if we're doing extractions, we have to have the dental drill set up ready. If we're doing something like more complex cases like skin grafting, we have to have either a long kit for osteotomy cases and so on. And we take documentation during the procedure, before and after. It's important that you take good record keeping of the patient whilst they're being operated. So it could be under GA, under general anesthetic, or IV sedation. We take it accurately and accordingly with the timing and the staff members that are present during the procedure itself. Non-touch aseptic technique, I'm sure obviously you are all aware of what it means. It means that when you are gowned up with a surgical gown, you can't touch anything from your sterile film. Obviously again, main theatre environment is strictly controlled in terms of infection control. So also known as surgical ANTT, aseptic non-touch technique aims to prevent surgical site infections by maintaining a sterile environment, just as I said earlier. During procedures, using sterile equipment and employing strict protocols for hand hygiene and personal attire. This is according to the ASEAN 2020. And this diagram here is what we use when we do a procedure. So it's not just like a simple 6 steps technique of hand washing. We do the proper surgical hand scrubbing technique from your hand, wrist, and then the elbow. Obviously, we use a PV scrub to wash your hand, not the normal alcohol gel or soap. So infection control. In theatre, the surgical instruments are prepared in a sterile environment, so there will be like a clean area and a contaminated area. So the clean area where we set up the instruments, and after the procedure we rub things up and then we put it in a contaminated area ready to be given to Synergy or the CSSD. So the surgical instruments are prepared in a sterile environment and is separated from the contaminated area to prevent cross-infection. The patient wears theatre hat before they come into the theatre as part of the infection control protocol, and will be covered with surgical drapes whilst they're either asleep, or if it's under local anesthetic, they'll be conscious, but they're still going to have a surgical drip on top of them. It's part of the main theatre protocol and infection control. So for scrub nurses like myself, as a lead dental nurse, I'll be wearing surgical PPE such as the gown, mask, visor, gloves, and a hat to maintain the sterile environment. Obviously, you have to have appropriate footwear as well. We have to avoid something with the holes, just in case of the blood spill or any sharps that might drop, just to prevent you from having sharp incidents. So this is what it looks like, obviously. So infection prevention and control is a practical evidence-based approach preventing patients and health workers from being harmed by avoidable infections. In main theatre, as I mentioned earlier, it's a strictly controlled, sterile environment. So for patients having a surgical procedure, you have to be alert, you have to be attentive, you have to be aware of your surrounding. And this is because we have to prevent infection, as we said there, most importantly to avoid patients having sepsis. If you don't know sepsis, sepsis is a type of infection that can cause harm to the patient's life. So, importance of communication. As you all know, within the team, we always have to communicate effectively. You can't just rely on one person relaying a message and assume that that's what they meant. Obviously, we come from a different background. We have a language barrier within ourselves. So it's important to have a clear and concise communication, especially when looking after a patient. So strong communication skills are essential to provide safe, quality, patient-centered care. Nurses develop therapeutic relationships with patients and family members each day to ensure that healthcare concerns and needs are addressed. If communication breaks down, information exchange stops and needs go unidentified. Nurses optimize communication channels with patients and families by establishing trust and actively listening to healthcare concerns. Additionally, the nurse is vital for ensuring that information transfer occurs within the multidisciplinary team. Communication with other healthcare members is a professional, organized, accurate, complete, and concise. If anything with communication, if you break communication, then obviously it can cause delay, it can cause harm to the patient, and obviously it can cause breakdown within each members of team. Everyone's okay, I'm not going too fast. So the full theatre team, so this is each members in one particular theatre when we are looking after the patient for the surgical procedure. So we have a lead anesthetist. They will be the ones that are in charge for giving general anesthetic or IV sedation, ensuring that patients are looked after with the vital signs, that they're breathing most importantly. And then he will have a, sorry about the cartoons, but yeah, it's my idea. Secondary anesthetist to help with the lead anesthetist. And then we get the ODP. I'm not sure if all of you are familiar with ODP, which are the anesthetic practitioner. They're like the nurses within the anesthetic team. And then you have the lead surgeon, which could be a consultant or a supervisor. And then the operating surgeon, which will be doing the procedure itself. And they will have the assistant surgeon. So yeah, so that's the assistant surgeon, and obviously that would be me. Because obviously in a secondary care setting, dental nurses are classified as scrub nurses, obviously with our own maxillofacial specialty. And then you have your circulating nurse, very important from the team, because obviously once you are scrubbed out, you can't go anywhere at all. Within the theatre point, there's a distance between where you can come closer, and again, for infection control purposes. So the circulating nurse or the healthcare assistant will be in hand to give you those opening of consumables, additional equipment and all that. So they'll be the ones running for you. So they are very important for the team as well. So I'm going to talk about the whole theatre checklist that we do every time we see a patient. So during briefing, we do a staff introduction. So we introduce ourselves, our role, and obviously of who we are. And then we discuss the patient. When we're discussing the patient, we make sure We discuss whether they're coming for local anesthetic, general anesthetic, IV sedations. We all know which treatment plan are we going for. And then signing in. So signing in happens before we start the anesthetic for the anesthetic team. So they verify the patient information through the consent form. They will either have a red wristband if they have any allergies. I'm sure you're all aware of that. And then timing out is once the patient is asleep, the surgeons and the rest of the team within that theater will again introduce themselves. And then they're gonna confirm from the blue checklist that whether they need a warming, an antibiotic, a pre-antibiotic, regional glycemic block, or local anesthetic on top of the general anesthetic that was given. And then signing out is once they've done the procedure, they have to verify it, confirm that they did the right procedure, obviously using the consent form that they filled out. And if they're going to be given a post-op antibiotic, they'll be either be transferred to recovery for the general anesthetic patients and IV sedations. If it's local cases, then obviously it depends on the procedure. Debrief is the one when we do it collectively, so we discuss about what went well, what can be improved. It's very important that we do debrief at the end of the day so we know how we can do for next time. And then this is my idea of the patient surgical pathway in theatre. So the patient comes in the surgical ward where they're being assessed by the surgeons and the anesthetic team. Obviously, if they are coming under GA or IV sedation, they need to be fast. So fasting is very important. If they eat, obviously they can't proceed with the procedure. Local anesthetic case is fine that they can drink water. So when they go to the main theatre, we'll be giving them a theatre hat, a surgical patient gown. And obviously we will have the notes to ensure that we have the right patient, the right consent form and everything. And obviously the right wristband for the patient. Sometimes you might encounter with the same name but different date of birth, so you just have to be extra mindful about that. And then recovery. The recovery team will look after the patient. After the patient had the general anesthetic procedure or IV sedation, they'll be the ones enabling the patient to regain their consciousness, and they'll explain what has happened to them. And obviously there will be like a post-operative care and assessment at the end. Furthermore, they will need further monitoring if they need to be in a post-operative ward where they can fully regain their consciousness and they can recover, ready to go home. For day case, we are talking about patient under local anesthetic. They are coming for like minor surgery, and then because it's not general anesthetic, no gas alarm or anything that will put them to sleep, they're okay to go home straight away, but making sure they're feeling alright. Like the vital signs and everything on check and everything is good. So teamwork. According to the NHS Improvement Hub, Productive Operating Theatre, the 642 model supports theatre teams to work more effectively together to improve the quality of patient experience and safety and outcomes of surgical services. The effective use of theatre time and overall staff experience introduced to the NHS in 2019. So this is a diagram that I did some research about how patients are booked prior to their procedure. So in total, there are 12 weeks prior to being booked in the operating theatre. So 6 weeks, they have to declare that all the members of the team, the surgical team, that their annual leaves in advance are sorted. They know who will be present during that time. 4 weeks down the line, they'll arrange the shifts list for 4 weeks before signing off. Signing off means it's still 50-50. So there's still, could be changes in between, whether the staff is sick, the staff has annual leave or anything like that. And then 2 weeks down the line, on the 12 weeks lockdown, that's when the patient is fully signed off. So that means they can't change the appointment dates anymore. So 12 weeks is the duration of the patient when they come in for surgical procedures. It's very good to know, to be honest. And then why effective team working is important, as you all know. Whether you work in hospital or practice, no one in here in this room can lead a case with just one person or two people. Even the dentist would agree, or the dental surgeons would agree. So why is it effective? Successful surgery in healthcare in general depends on effective teamwork. Evidence suggests that adverse events in surgery may often derive from an aspect of team system design. Enhancement of team performance in the operating theatre should therefore lead to increased safety. Obviously, we're all here for the safety of the patients, so we work together and we aim for the same shared goals, and that is to provide excellent care to our patient. The best definition for teamwork in nursing in the UK, according to the General Dental Council, is a patient-centered approach focused on shared goals among nurses. This definition emphasizes the importance of integrating each nursing team member's unique strengths and skills to deliver high-quality, effective nursing care and achieve positive healthcare outcomes for the patient. Again, everyone here is different. Everyone here have different skills and knowledge. So during teamwork, we have to share our differences. It's important that we work together as one. We have to build relationship, trust, and obviously reliability. We have to be dependent on each other. Obviously, we are focused on the patient care. That's the most important thing. And obviously, here it says patient experience and outcomes comes with team performance and staff well-being, safety and reliability of care, and value and efficiency. Who doesn't agree with me that teamwork is not important when you're running your patient day-to-day basis? Obviously, we have to work together to make sure that the patient has the best experience when they come in and when they come out. Because obviously, most of our patients are nervous, they are fearful, they are anxious. I'm sure everyone have encountered those experiences. So, yeah. So, conclusion. So a theatre dental nurse plays a key role in supporting and running of a surgical theatre environment, whether it's scrub or circulating. In main theatre environment, you can be either scrub or circulating. As a scrub nurse, I think the most important is to have a good attitude, good professionalism. You have to have a good anticipation, obviously when you're passing instruments, to have a good knowledge when you're handling the instruments. You have to know why you're doing it, you know why you're setting up for this certain procedure. It's best to have it like a few steps before the oral surgeon comes and work with you. You have to work collaboratively. And as a circulating nurse, obviously you have to run for the team. If the team needs something, you have to come out the theatre and get something. You have to get the right equipment and everything. You have to have the knowledge and experience as well of what is happening within the theatre field. And then, adhering infection control at all times is important to maintain sterile environment and prevent cross-contamination. As I said before, infection control is a good practice for everyone, especially when you're working in operating theatres, making sure that you are not doing the cross-contamination or cross-infection. You're draping, you're donning your surgical drapes, surgical gowns. And then an effective communication builds a good relationship and trust between team members, delivers safe and high standard quality of care for patients. Obviously, we have to communicate with each other. If there is a language barrier, it's always someone who can speak the language. We should help each other rather than contradict each other's responsibilities and their attitudes. Lastly, team working is essential as it develops unity. It creates one vision towards the same goal when providing patient-centered care. So again, in the theatre, there is no such thing as an individual can run the list on their own. You have to work together collaboratively. You have to respect each other's differences, the strengths and weaknesses, the boundaries. If they have, like, again, language barrier, or someone is newly qualified, someone is been here for years. So there's no hierarchy. You just have to work together. Look for your patient, making sure he's reassured, he's safe, and he's been given the surgical procedure that was meant to look after the patient. So, these are my references. If there are any questions for me, please, if you can find me on stand 835 for the SBDN stand, it would be lovely to meet you. I mean, some of you guys. I mean, I don't know if everyone's gonna find me, but yeah. I hope you enjoy this presentation, guys. Thanks so much. And that's me.
Hello guys, so I just did my speaker talk as I was discussing about dental nursing and oral maxillofacial tears. So I hope you guys enjoyed it. I got a really good footage of it. And at the moment it's getting crowded inside the dentistry show for this year 2025. People are coming. And yeah, we have good numbers. So I'm gonna get some CPDs and some goodies. So hey guys, let me show you what's happening right now. I'm just like right in the middle. I'll do some 360. Let's go. As you can see, it's a lot of people. A lot of companies. And yeah. See you guys in a bit. What's up guys, so I'm joined with Singing Dentist.
Yo, what's good? What's happening? Keep brushing.
Keep brushing, yeah.
Let me take that.
So yeah, man, I enjoyed your presentation, man.
Thank you very much.
Good vibes.
Always good vibes, and it was a nice chat about emotional dentistry here at the Dentistry Show,
Definitely.
and yeah, it was good. Good turnout. Everyone seemed to enjoy
Talk
it.
about real talk, life dentistry. You know?
That's it, man. 21 years in the game. So yeah.
Yeah. Follow this guy, man, and obviously subscribe to my channel. Retro Radio.
Big up.
Yeah. Thank you, man.